professor down at Missouri State University that did the project on English language learners and the research. So that inspired me to encourage some of the universities to work on something with gifted. And so the Truman State University is working on a research with a survey to students, parents, and teachers about how gifted students are doing during the pandemic. So,
Very good.
I can't remember what month that was, but that was
Dr. Hellman.
Yes, thank you.
And I believe it was November.
And she's right here.
Yeah, she is.
I don't know if I think it's the background, Dr. Hellman. I think you were in your office in the last, in that, or you had an office environment.
Oh yeah, it was the same, just a backdrop. I have a pretty boring wallpaper. I mean, I meant in reality.
In reality, right, instead of the virtual world. Well, anyway, so thank you, Dr. Hellman. Now that I realize, like, oh yeah, you're right there. Yeah, you inspired us.
Thank you.
There's your real
follow-up of that one too. We did a second study, what happened in the fall, and yes, so I shared some of that with you, but I'm building on the findings of that study.
Yeah. So yeah, I appreciate it. I just wanted to kind of mention that.
Thank you.
Well,
all right.
Are we waiting for anybody else?
No, we can go ahead and get started. I'm going to start sharing our slides. Just give me a second here. And
okay.
Find it. Oh, hang on a minute. I've got to pull up the right slide to get it to show. But Laura, if you want to go ahead and introduce yourself.
Sure. I'm Laura Beckmann. I'm with DESE, the Director of Missouri Healthy Schools, and I oversee 3 different grants. One, which is the Healthy Schools Grant. It's very competitive with 17 states on healthy school policy development, which we're going to talk about, and how the barriers to learning and access to healthcare and things like that really, or health behaviors in itself relate to academic achievement. The other piece is that I also am the overseeing YRBS, youth risk behavior data, and school health policies data, which kind of shows us what policies are in place that support student learning. And then lastly is a supplemental funding that's very much COVID-19. And in fact, CDC just released more money to us, and we have an application due April 26th on how we support school districts with COVID-19 guidance from CDC, specifically to SEL, mental health, and vaccinations and testing. So I'm excited that yes.
So welcome everyone to our Learning Collaborative. And again, I put the hub link into the notes. You can use that to sign in and find the slides and note taker. Please sign in on the note capture. And again, Laura's going to speak to us today about the WSCC model, and we'll end with some questions and comments. And of course, our housekeeping is always the same as our community agreements. And I don't want to waste any time because I know how Laura has lots to share with us. So I'm going to just kick it off with you, Laura. Let you take over.
Okay. There we go. Okay. So I'm going to be speaking about the whole school, whole community, whole child model. And within this model, it really is a systems approach of where districts come together, break down silos. They look at gaps of what is happening to support student and staff well-being, or the whole stakeholder around the whole school community. And then we'll also talk about the professional development and technical assistance that is provided through that. So with that, currently, often what we have is we see buildings, and I know I've been in school districts for a long time, over 28 years of public service in school districts. And I have been involved at the elementary, middle, and secondary level, in which you're on several committees, right? You're on the care team committee, you're on the academic committee, you're on the diversity committee. You have all these committees, but none of them are talking and have a lot of data that supports the health and well-being of that school community. So when you look at health behaviors, or the hub of a school that supports student behavior and student well-being, or staff well-being, or parents and families of their kids going to school, you see that a lot of it is just disjointed. And what the WISC model does is it really brings the hub of, there's 10 components that support well-being within a school culture. And when you bring those components together, then those people assess themselves with a evidence-based assessment tool by CDC and the ASCD, and then plan, much like your academic achievement, they will plan a school health improvement plan and implement and evaluate. When you're bringing this together, it reduces duplication, it fills in gaps, and it provides a much more awareness of what's going on, and it allows you to get into the root cause of why students aren't achieving. For example, and I'm just going to give you one example. One of our school districts had not had vision screening, and it was their middle school students. They were able to get a vision screening van finally to their middle school, and they found out about 100 students could not see. They needed glasses. But what do? We think that it is a reading issue, right? And it really is much more than that. It's the child is having issues seeing. And when you don't support those health issues or barriers to learning, we try to fix it through what we think is just through the academic pieces that were our findings, instead of really looking at what the root cause is. So as I said, Missouri Healthy Schools is really about supporting schools with the knowledge, tools, and support to achieve student health and also long-term academic success. The states in the yellow are the states that have this grant, and we have monthly calls. We work with CDC directly, and we help schools systems, LEAs, to develop infrastructures that align and break down silos, the work of creating a school health culture that creates academic success. We provide professional development and technical assistance on whatever goals and actions that they are able to see and utilize through their assessment process. So when you're looking at the CDC Healthy Schools website, this really tells you a lot about what our mission and vision is through a state level. It talks about behaviors that are linked directly to academic achievements, such as not eating breakfast, such as food and mood, SEL, and nutrition, and how it affects emotional regulation, and social awareness. It talks about assessments, school health assessments. How do we manage students with chronic conditions? Is there equity in what our kids with chronic conditions have as far as learning? And let's think about this year with COVID-19, when our after school programs were shut down. And those often are those enhanced programs to get our students into improving their learning with Title IV funding, right? Well, they're shut down. They're basically helping with childcare this year. They're helping with food distribution this year. Some of our district sites are serving food in 5 different ways because of the different learning modalities that are chosen. So with that, do those kids have equitable rights to after-school programming that's going to help with their learning? Oftentimes there's chronic absenteeism. We have 72,000 kids in our schools that have asthma, and they miss an average of 10 days of school a day, which is known as chronic absenteeism. We have kids that have these chronic issues, but there's no support for after school from a school nurse to assist with diabetic needs or asthma needs. So how do we ensure that those kids have that access? We have about 80, I want to say 80,000 kids that lost access to Medicaid this year. So how do we get them to get the insurance and the vaccinations and things like that and have a medical home so they can get that help that they need? So back in the 1980s, CDC introduced the Coordinated School Health Model, and ASCD introduced it in 2007 with the Whole Child Initiative. And then CDC came together with ASCD in 2014, and they developed the Whole School, Whole Community, Whole Child model. So this is your largest education organization working with your largest public health to begin to really look at how do we bring together those support systems to really basically use Maslow's hierarchy of needs. If we're helping students with their health, or if we're helping ensuring that they're safe at school, we can then give them the support, get them engaged and challenged in their learning. And if you go to CDC Healthy Schools, which I just gave you that website earlier, or the ASCD Whole Child Network, you'll see a lot of the work that's being done around the country and internationally with this work. Next slide. And we certainly have over 30 years or more of research that really shows certain factors and how it is related to chronic illness or poor school performance. And they actually have each one of these behaviors linked to grades, the CDC does. We know that kids who have a lot of, they're doing much better if they are meeting the physical activity needs of their bodies 60 minutes a day. We know kids that don't eat breakfast have brain issues. They're not getting the nutrients to their brain to actually pay attention in class. Test scores go up, attendance goes up, grades go up when we actually begin to address behaviors that create lack of success or barriers to learning. Next slide, please. Oh, I'm sorry. Let me just review that on the left, the Health Youth Risk Behavior Survey is a survey that we give out every 2 years to our high school students. We work in partnership with the Department of Health and Senior Services. Our high school students, these are 6 behaviors that we ask them about related to the top behaviors that cause morbidity and mortality in our youth today, such as suicide, violence, physical activity, nutrition, sexual activity. So we look at these behaviors and then we ask them, we kind of see what's trending. So if you think about nicotine addiction and smoking and how it's evolved now into vaping, and it's creating a lot of issues with our schools, our kids in schools, and being able to be engaged in their learning. Profiles is given to middle and high school lead principals and health education teachers to look at policies that support those behaviors that we're trying to reduce, risk behaviors, so that kids can actually get more engaged into their learning. So when you look at some of the data from those, we know that about 8.3% of students in Missouri have attempted suicide. We know that 16.3% of students in Missouri currently use marijuana. 72% do not eat breakfast. We have 18% that are obese. We have 67% who have indicated that they have issues with mental health. And when you're looking at all of this data, we're working with other state organizations to sort of look at how can we reduce the trends? How can we help those school communities really engage in policies, provide resources and tools and training that can then build protective factors in our schools. So those 10 components around the whole child model is health and physical education, nutrition, environment, health services, which is your school nurses, your social and emotional climate. What type of climate do our school districts have? And we certainly know that a lot of them are really looking at their climate and how they're enhancing with SEL learning, but also with just engaging families and parents to be a part of that conversation. Family engagement has been a huge concern and need in a lot of our districts. Health services, do they have access to nearby systems of hospitals? We have Kennett School District that has no hospitals. Their hospitals closed down. So the next hospital is within 100 miles away. You know, these are the issues of our students and their families and what they're facing when they have those needs. Counseling, psychological, and social services. What systems do you have in place? Is it a multi-tiered approach? Do you have a universal learning and screening piece of it, but then the group of tier 2, where we're pushing kids to get group therapy, tier 3, referring them to those outside systems? How many school districts actually have psychological or psychiatrists on board, or psychologists, or social services? And there's a huge need there. The physical environment, how safe is it? Employee wellness. If we don't have employees that are healthy, we're certainly not going to have healthy students. Family engagement, community involvement. What resources do you have in your community? If we are able to bring these components together consistently through what we have as the Healthy Hunger Free Kids Act, which is our local wellness policy mandate. All districts have a local wellness policy. Within that policy, they have components on which they're bringing this type of team together on a comprehensive school wellness approach that includes all of these pieces that impacts learning. So when you coordinate these systems or components of support together, with your community resources, we then can really address the health indicators, the safe indicators, and the engaged, supported, and challenged of our students. So therefore, you see Maslow's hierarchy of needs. So we have about 69% of our school districts that are actually compliant with local wellness policy, but we have work to do with getting all of them compliant. We also know that we need to expand this wellness policy, model wellness policy, to a more comprehensive approach. That health and safety has to go together, and it should not be segmented. Often when we look at safety, we think of just violence prevention, when in fact it deals with protocols that you have in place as far as chronic disease or health services or physical environment. And it could be just, triggers for kids getting asthma attacks, things like that. It's a much more broader way of looking at those supports. Next slide. So really it involves this interconnectedness of several systems with the families and community organizations, healthcare systems, state agencies, all working together to improve this model from a state approach. It's a federal approach to a state approach to a district approach to actually a school approach. And each school has different needs. We know that, different zip codes have different needs within a LEA, that there's several schools that will have common needs, but they also have diverse needs based on what their assessment results will find. So the role of the community, showing the connections between health and academic achievement, You know, there's many connections where kids that are not eating breakfast, their academic achievement is lower. Again, really looking at taking some of your academic achievement data and some of these health outcome data and beginning to tie them together to look at how they really complement one another and leverage resources to support that. The importance of evidence-based policies. So again, we're coordinating pieces, we're getting rid of silos, we're facilitating awareness of issues. What I find what's really impactful and I find is really, and I'm hearing from the local districts that we work with, local wellness policy work that we're working with school districts on, their biggest thing that they love is to hear what other components are working on, because they're only in their own system of work. They don't really understand the policies. They don't understand what the school nurse is doing. They don't understand what type of climate pieces that are going to address what they actually might be able to contribute to. So they can begin to leverage and work on goals around component areas and feed into a common goal, leveraging resources, and then of course, reducing duplication and filling those gaps. So that's what Missouri Healthy Schools is really about, is helping schools to develop infrastructures. When you look at the whole childhood community model, when we're looking at the local wellness policy mandate, it specifically states in there that school districts should be using the school health index. And then another tool to assess that. So in Missouri Healthy Schools, we have about 30 school health index trainers that can go around and help districts to walk through the process. They also have an e-learning index, but what we certainly want is to have school districts to utilize their local wellness policy team, see who's missing, who's not at the table, and then begin to go through this process of assessing as a team, not individually, coming together and really looking at the strengths and weaknesses of policies that you have in place and develop about a 3 to 5 goal action plan. It could be, you know, the goal of going, it's a ranking of a 3, 2, 1, 0 process. It could be the goal of, you know, moving from a 2 to a 3, or it could be something very strong where you have nothing in place and you want to build upon that. Certainly, once they begin to develop this, they can begin to tie it to various academic data. So for example, when you look at social and emotional climate, if they take the school health index, that's the foundation of their policies. But then we also know that school districts have PBIS data. They're utilizing CASEL data with Panorama. And so they can begin to layer that data to really get into a strong strategic plan, action plan, that's going to address change. And that's really what this assessment will do, is it builds that foundational piece to build that plan and then begin to layer all of those pieces on top. Next slide, please. And districts do not have, you know, they can just start with one component area. So when districts take this assessment, they then will come out with a scorecard. And it's really easy to export the data of how they're scoring low, medium, and high, and then really evaluating the importance, the cost, the time, the commitment, the feasibility. What's doable to really create change? And then of course, there's some school improvement plans of health and wellness that can help to districts to move forward in really developing, utilizing other sources of data within their buildings or at the state level to create change. Next slide. In the whole child, they have a climate survey, and their survey is around the WISC model too. It's called the School Improvement Tool. And that school improvement tool really helps to assess on how safe, how well are you addressing the healthy indicators of the whole child? How well are you addressing the safety indicators? There are 10 indicators within that. And it goes all the way up, and then it is aligned to the WISC model. And then you're able to really evaluate as a school climate how you're addressing that. And so you can really utilize both assessments as some of your baseline data to move forward in that work. Most school districts are utilizing this as one of their very first assessments. Other districts are utilizing different tools. The U.S. Department of Education has a climate survey. So again, beginning to build those tools and those assessments together to really create a whole child plan. Next slide, please. And the whole child network does have ways to get into it has a support system of about 1,500 educators, and they constantly are providing some professional development and technical assistance to move forward with this, addressing this, the needs of our students so they can get engaged. So as I spoke before on the slide, there are 10 indicators. And if you open up the PDF below, you'll see how it relates to in the education components that we work with. It relates to school climate and culture. It relates to your curriculum and instruction. We know many districts or many of the content areas are focused on SEL and how to embed them. And it really goes into that piece when you get into the assessment. It goes into your leadership, your assessment, your PD and capacity, and your community and family. And certainly when you're looking at a continuous improvement plan, these are the components, the indicators are aligned to those components of what a continuous improvement plan would address as well. So it takes some time to get in there and look at the indicators. And obviously the whole school fits into this, no matter what content area, classroom teacher, nurse, facilities manager, administrator, we all fit into all of these pieces. Next slide, please. So in each stage of the school improvement process, the WISC model really is going to help incorporate that physical, social, emotional, and behavioral health priorities in your school improvement. So just like academics, now you have a school improvement that is really directly related to your health and well-being of your school buildings and your district LEAs. School buildings assessment data can be rolled into a district improvement plan, and it could be related to your Missouri School Improvement Plan goals. So again, going beyond what just we're seeing in academic data, but going beyond that to really look at the support systems of equity and access to all students. When we think about cultural barriers, they have much more cultural barriers than just language, but many of our students from diverse communities don't have access to health care. Therefore, they don't really reach out for that help because some of them may not be US citizens yet. So it becomes a really deep dilemma on helping kids to begin to really get the support they need so we can help them with their learning. Christine, I saw in the chat, yes, Missouri Green Schools is a US Department of Education, and this directly can relate to that award for Missouri Green Schools. So we've had several school districts that have utilized this as a means to gain that award and are doing amazing things, Once the school improvement plans are created, then Missouri Healthy Schools hooks people up with whatever their professional development needs are. We bring in experts across the Missouri Healthy Schools team, and then we help to monitor and track progress on implementation of those goals, and then evaluate that impact on both health and academic outcomes. Next slide, please. And this again is very unique to every school community, because every school community has different resources. They have different cultures. We know that we have some districts that have 23 different languages in their district. They have different time. We know our rural districts do not have as many resources as our suburban districts. You know, their leadership is different. So again, engagement. So thinking about that when they're doing their local wellness policy plan and they're building this infrastructure, they can utilize what they already have in place. Who's missing? Who's at the table? And how effective is their process currently on identifying goals and actions and creating that policy, practice, or behavioral change? So again, this framework is modifiable and adapted to every school community's needs. Next slide. So some of the examples is that we working with Bayless School District, and some of the great examples, they're one of our priority school districts, is that in their wellness plan, they really are focusing on staff well-being. And so they have worked with three other local districts, and they're also working with Dr. Drew Schwartz. And this has been initiated by their physical education and health department. And they have what's called their 1-2-3 wellness library. So they do Zoom sessions with the local university and 3 other school districts on mental well-being for their staff. And they're giving those strategies to their staff, which their staff are then also utilizing with their students in different instructional modalities, in models. So again, giving them the tools to not only address their own mental well-being, but to also address the well-being of their students and their families, and sharing those strategies. And this has become something that has been really huge. We know that staff, a lot of staff are really hurting with the COVID-19 and some of the different things that they've had to deal with this year. And that's one of the key primary goals that we'll be working on again next year. Nationally, CDC is working with us to really help with staff mental well-being. So I wanted to bring that as one example of a school district that is utilizing the WISC model to improve staff well-being. Next slide. They also have panorama data, and many of our school districts in Missouri use this. And this is something around, it's from the CASEL, it's related to CASEL, but a lot of districts have surveyed their students on emotional regulation, social awareness, do they feel like they have supportive relationships? And then they're utilizing that multi-tiered approach through their counseling and psychological and social services to address those students that are identified on that second tier level. So really being responsive to the survey results. And there's playbooks and activities and resources available through Panorama in this work that helps them to guide those students into a track that's more positive, and build those positive feelings and social emotional learning pieces. Next slide, please. They also developed a Facebook wellness page, and so on this Facebook wellness page, they're building a community of health. And this is what their local wellness, their district wellness committee is doing. They're bringing students in to become a voice, which they should be in this work. And the students are actually vocalizing what issues they want to talk with district administrators and how they can help bridge that, help them to move forward with their well-being. So the students are actually becoming a very big voice on their district wellness committee in guiding their work in their strategic goals. Next slide, please. Another one that, again, and when we look at learning and STEM, you know, we see a lot of districts incorporating nutrition education. There's been a lot of studies about gardens and the social and emotional piece of it, as well as the, you know, project learning, tying it to other agricultural pieces or careers of diverse careers like dietetics, even health services, agriculture. So this one is in Jennings School District. Missouri Healthy Schools provides funds to priority school districts, but it is a statewide approach to help other districts move forward. And next year we will be giving scholarships for districts to begin some of this work. So this is a sample of the towers, the growing towers that were installed, and the teachers are being able to, they're doing so many harvests per year. The teachers are being able to take some of this produce home. They're also having students to do healthy plate days. So it's in Healthy Kids Day. They're increasing students' exercise during the day so that we begin to get that increase of brain activity for learning that is evidence-based, and really helping with student self-care. So when you think about it, when you think about food insecurity, and some of our students do not have access. And in St. Louis, they actually opened up a new law of people actually having chicken coops, that they can have their own chickens and raise their own chickens. And so again, this is not only helping them to understand just nutrition in itself, the growing, it ties in science, it can tie in social studies, it can tie in English language arts, it ties in math, but it really is beginning to also take it beyond the class into what can you do for your own family? How can you address food insecurity? How can you begin to work with your local farmer markets and really move forward into even a broader approach of opportunities? So again, this is another example of building these units of instruction that go well beyond any content area and into what the needs are of their own families and communities. And a lot of school districts are now also installing their their gardens outside, and they actually are feeding communities within their gardens outside. This is another example of what students are doing in the Bayless School District. They know that a lot of their kids are drinking beverages with high sugar. Well, what does high sugar do to the brain during the day of learning? Within 30 to 45 minutes, they go down into a sugar crash. And so really getting rid of that sugar, trying to get kids to drink. A lot of our districts have installed water refillable stations, not just because of COVID, but also that we know that drinking water throughout the day will hydrate the brain and increases learning, so, and cognitive thinking. So again, taking this evidence and putting in these types of approaches. This is led by our students. So again, it is a student-led activity that can combine all content areas. It's project-based. It's a campaign to then reverse, because we know peer-to-peer learning, peer-to-peer movements like this really can create change. Next slide, please. So the students are becoming the leaders of this work. Also, when you're looking at strategies for using the WISC framework, you can look at specific component areas and then look at each one of those like a specific topic. So let's say that, that they're really focused on their nutrition environment, and they really want to impact employee wellness through nutrition, physical environment with nutrition, social and emotional climate. They can look at, again, bringing those component areas together and look at how they can, as a team, begin to start a cohesive way of addressing one goal around a topic. So once you identify that, you can then begin to have a lot of different creativity in addressing that around that whole child approach. So right here, I want you to think about, because in the next, 30 minutes or last 30 minutes of this, I really want you to think about in what ways are you currently on, and or could you better align your work to the WISC model to build healthier school cultures, reduce risk behaviors among students within the school community that could also foster student success. So I want you to think of that question, because we all come together with different backgrounds. We all come together with some really good experience in which creativity is at its top of how we could begin to coordinate and work together and think about other ways. There certainly is a lot of great work going on, but there's always another one that comes out. Out of school time, working with your YMCA or your after school alliance programmers and being more strategic on addressing learning. And I know that accelerated learning is something that we really need to work on, and we're very focused on this group. So how do we begin that approach? By bringing in our out of school time providers and really working with them to enhance that through their Title IV funding. So as we think about the new year, or how do you engage local wellness policy and become a part of a district team that looks at academics with health and begin really moving forward with that? Next slide, please. SOPHE, which is the Society of Public Health, they have really put together a strong training module where districts don't have to start from the beginning, but they may have a really good, strong team together. Their district wellness committee might be consisting of 29 community organizations with those components on the WISC model. But how would they begin to maybe look at data really more strategic, or how do they want to engage youth? So if you look at the screenshot on the left, you'll notice that they can really look at health equity separately, or they really can look at assessment separately. They don't have to go in a sequential manner, but they can pull out their readiness level here. It also has some great fact sheets on health equity. They have scripts, they have handouts, they have PowerPoints. They talk about equitable schools and creating partnerships with other community members and school partnerships with community health providers. So again, or out of school time providers that can enhance learning through health, maybe health topics. So again, this is another great resource. They have a great SEL framework with WISC model that can be utilized to sort of align those efforts. So a lot of great resources and tools are being developed and can be utilized by school districts. And Missouri Healthy Schools, of course, can support with that professional development, training, technical assistance piece. Next slide, please.
There's a question. They wanted to know if this goes down to early childhood.
That's great that you ask that, because there is that going on with early childhood. There is another CDC grant, and certainly we are partnering with DHSS on early childhood through K through 12. So yes, those pieces can be related to early childhood. They do have the Move Smart initiative that's going on. We partner with the Missouri Council of Activity and Nutrition. We partner with the Missouri Foundation for Health, the Department of Health and Senior Services, Missouri Green Schools. We have a lot of partnerships. So yes, early childhood is connected in this work. I'm just focusing on K through 12, but there is a huge focus on pre-K. This is the site of that Missouri Healthy Schools on the DESE website. And if you notice, there are little tabs that connect you to specific components. Within each component, there are several resources. I want to also take you to that state health data piece, because that state health data piece is the data that's there for you to review trends or policy trends that are happening in our schools. So particularly when you look at the top behaviors that are affecting morbidity and mortality, think about it as kids who can do campaigns, or they can relate English language content or social studies or math to topics that are health behavior issues like vaping or mental health, and really look at state health data to drive their conversation and their work within those content areas. So again, something to think about that can help look at those and have students look at data and think about opportunities on how they can reverse some of those behaviors that are affecting student success, or even offer peer-to-peer support within their school system. Next slide, please. We also developed a Missouri Healthy Schools website. The Missouri Healthy Schools website this is one that we did with CDC that's COVID-19 related. And these are around priority areas that the CDC identified at the beginning of the 2020-21 school year. And so we are every day posting new webinars. We have our YouTube channel. We do interviews with school districts. We have grant opportunities for access to many of the grants out there that can affect mental health or school well-being. DESE we just applied for the Mental Project Aware grant for the Kansas City Public Schools. There's a lot of little funding opportunities. There's also recorded webinars. So certainly a newsletter, you can subscribe to this, you'll get the newsletter. There are some new things that are going to transcend from this in the next year. CDC's given us more funding, and we'll be focusing a lot more with some new activities, but certainly using this same communication system. Next slide, please. And if you look at DESE's strategic plan, you'll see that there are 4 main priorities, and safe and healthy schools is one of them. We brought in Sean Slade from the Senior Director of Global Outreach, ASCD, and Dr. William Potts-Datema through doing some statewide collaboration series. And those are recorded, and you'll be able to access them through that link. Currently, DESE's working on a strategic plan. And 2 of the goals within the strategic plan will fit under safe and healthy schools, as they do every other priority area here. And some of us on this call are certainly, involved in that process. So with that said, safe and healthy are working together. They're committees, because we know they can't be separated. You also could go to the 28th Annual Coordinated School Health Conference, where they have recorded sessions on really the processes, the tools, to get more in depth on what can be used to move forward with evidence-based processes and systems to create change. So again, those are there, and we have several districts that are showcasing: Kirkwood, Farmington School District, Associate Superintendent Ashley Krause does an excellent job with the whole child WISC framework and how it's driving change in her district. So again, there's certainly some great things happening across Missouri, and we're getting ready to push a huge communication system out with other states through CDC. So again, I know you have a lot of stories to share probably, and I'm anxious to hear from you, your thoughts and what you're thinking. Next slide, please. So again, my contact information is here. You can contact me anytime, but this is a model that really is for child's sake. It's focused on a child, and then how do we build and help support that child so they can learn in our schools. So with that, this is sort of the end of my presentation. There are the PDFs in there that I would like for you to look through to kind of get a sense of the indicators. And I also, within the Google Docs, I shared the slide deck of some of the data on policies and practices, supporting students. And DHSS has created a lot of infographics that are really, that high school students helped make with them on some of the data that we're finding from our student surveys. So next year we will be doing more student survey data to see if what is trending among our students in those top behaviors, as well as we'll do another policies and practices survey. So with that, I'm going to stop my presentation, and I'd like to invite you all to sort of talk and tell me about your thoughts. What are you thinking? How do you see this aligning to your work?
My name's Shanika Harris, or Williams, sorry, new last name. And I may have missed it, but will the funding help with providing nurses or counselors or anything of that sort? Or is it just to help with the actual process once you have those people in place?
Yeah, that funding, now there are a lot, that's a good question, because there's a lot of funding out there right now. That funding that I have is not much. It's really helping with the process and the coordination of moving forward with an infrastructure that doesn't matter where you are, you know, what health issue hits your school community, you have the team and the process in place to address it. And that Farmington their hub was connected. No matter if the COVID hit or not, they already had a strong hub, where some districts, their hub was disconnected. So they were like in complete chaos, right? But there is funding through the billions of dollars to help, maybe to increase access to school healthcare services or psychological services. There's funding through the COVID-19 that I have with more of professional development on and support in SEL and mental health. But you know, like your PPE equipment would come through your CARES Act funding. So certainly districts are kind of looking at those different pockets of funding and figuring out where they could best support. But that's a great question.
Thank you.
Laura, I was the one that asked about the early childhood piece, and I work with a lot of early childhood educators. What were some of those programs that you mentioned? I didn't get them all down.
There is Move Smart. And that is a big campaign that's really starting to be launched here shortly. This group, MOCAN, Missouri Council of Activity and Nutrition, they have a strong early childhood group on policy development. They also are part of this governor's work, you know. So again, probably the person that you would be most connected to is Pat Simmons with Department of Health and Senior Services. She is sort of the bureau chief, and she leads a lot of this work with early childhood.
Okay, thank you very much.
Mm-hmm. And of course, you could also tap into Desi's early childhood person. Oh my gosh, I know Debbie. She can remember that on their committee.
Oh, yeah, Cheryl Stock and Pam and Joe Charleston and yeah.
Yes,
Those
yes. Them
Okay.
too. Mhm.
Thank you.
Yeah.
There's
There was another.
go ahead.
Go ahead.
There's a question in the chat about where you can find more information about grants.
If you go to that Missouri Healthy Schools website and you hit funding opportunities on the, let me see if I can put it in the chat. It's MissouriHealthySchools.com. We're also looking at a means to sort of be able to, help people out there to identify those opportunities on the DESE, Missouri Healthy Schools website. But if you go to MoHealthySchools.com and you go in under the button grant opportunities, you're going to see a wealth of funding opportunities. And we continue to update that. Missouri Foundation for Health, MOCAP, and I will tell you this is great to know. MOCAP has a free grant writing team. So if you're looking at a grant and you're not particularly a grant writer, and you need help, you can certainly secure their help from MOCAP, from Missouri Foundation for Health, MOCAP. And they will, you can ask them if they would support you. And I do a lot of work with Dr. Eric Armbrecht, who does a lot of grant writing across the state. So if you wanted a contact person to help you with that and a team, you can certainly ask for that.
A little bit more wait time here if anyone has any other questions or comments. All right. Thank you so much, Laura. That was wonderful information. I'm sure a lot of people weren't aware of, didn't know about some of the things you've shared with us today. I know it showed me some things I didn't know we were doing. So thank you very much for sharing that. I put a few additional links from Laura into the note taker, and I will share this recording and the chat with you by tomorrow anyway. And we appreciate everyone joining us. And as the next slide says, our next meeting is scheduled for May 3rd. Please let me know in the note taker if you have any specific topic or questions that you want answered in the near future. I don't have anything planned for next month, and I'd like to hear what you would like to know more about. And we'll also discuss going forward with this collaborative, what we want to do for the future since we're coming to the end of the school year. As always, the repository is there. It's at this Wakelet link. And again, your collaborators in this, and I will be adding in some of this information that Laura shared under the Healthy Child section of our Wakelet. So, and any other questions or anything, you're welcome to contact me as well. If there's nothing else, thank you again, Laura. We really appreciate all the great work that you've done. And I look forward to seeing everyone next month.
Thank you. Thank you for having me. And thank you, everyone.
Thank you very much.
Have a great evening.
Are you still recording?
I can stop if you'd like.